So let us discuss about objectives of school health services and programs that are related to healthful school environment. So this is according to PSM, Preventive Obsterics and Geriatrics lesson. In that we will be seeing this question. So school health program was launched in 1960, in which the most important functionary of this school health functionary is school teacher, and India was the first to introduce this school health program services. So basically it emphasized on skin care, it emphasizes on eye care, ear care, and dental caries, and malnutrition, infectious disease, and intestinal diseases. So the health problems that are related to the school child is again the same things you can write here also. Extrava you will have a goiter. And next one is, what are the objectives of school health program? So you need to remember only one thing here: positive health. What is positive health? Which means there should not be any disease, there should not be any disease risk factor, like that. But ideally the positive health concept is not a real one, it is an ideal one, where no one can be said to have every aspect of health to be positive. But in case of a school health program, we should emphasize on giving such positive health to maintain a good social environment across the children. The next one is early diagnosis and prevention and treatment and follow up, early diagnosis and prompt treatment and follow up, and healthful environment and health consciousness. So these are the some objectives regarding school health program. Also, school health examination recommendations according to Renuka Rai Committee, according to National Rural Health Mission and the School Eye Screening Program. The Renuka Rai Health Committee recommended that the school students can be regularly, routinely examined for a period of 4 years. For a period of 4 years, and National Rural Health Mission recommended the school child health examinations for a period of 6 months, and school eye screening program, which recommended the students to be screened for the eye problems for the ages of 10 to 14 years, that is your 5th standard to 8th standard. The students of 5th to 8th standard students are routinely checked for the screening for visual acuity. Normally the cutoff referral for the visual acuity is 6/9. Talking about your aspects of school health services, what are the aspects we focus is the same whatever we have talked we have discussed till now. Your school environment, your environment safety, your health approach, and your nutritional service for to avoid malnutrition, your eye services, eye care services, ear care services, your mental health services, your personal hygiene, first aid and emergency care, and your health education, and prevention of communicable disease. All those steps whatever you have discussed in the previous part, the same it will repeat here. So remember this domain only. If you remember this domain, whatever I say you can easily write. So school environment, health approach, nutritional service, eye ear care service, dental service, first aid and emergency care, personal hygiene, health education, and prevention of communicable disease. So these are some important aspects that you should remember. Talking about school environment, the school environment should talking about school environment, the school should be located in a centrally situated place, proper approach to the road, and it should be away from the noise, such that the studying the learning process should not be affected, and proper fence should be there. There should be a proper fence. It should be centrally located, and it should be proper approach from the road, and away from the noise. Talking about site, the primary school should be 5 acre, and the secondary school should be 10 acre. The structure of this school should be, it should be single stored, and talking about classroom, the classroom should be adequate for 40 students only. It should not be more than 40 students ideally, and for per student it should have 10 square feet, And talking about furniture, it should have a single desk, and recommended type of desk is minus type of desk. That you should remember. There should be minus type of desk. What is minus type of desk? Which is nothing but the writing table should be at a higher level than that of the sitting table level. So that is the recommended type of desk level in the India that has been asked in entrance examination. And talking about doors and windows, it should have a combined door and window area of 25% of floor space. It should be placed on opposite wall such that you can get cross ventilation. So these are the same topics, again and again it has been discussed. So first I have said about location, and next I have said about the building, and next I have said about the site, location, site, and I have discussed about the building, I have discussed about the classroom, and I have discussed about the furniture. Now I will discuss about door and window, which should have cross ventilation, and the ventilator should occupy 2% of their floor space. And talking about the wall color should be white color. And talking about the light should have a natural light preferably, and you should preferably from left side you should arrange the glass, like the natural light should come from the left side. Water supply, talking about water supply, you should have a safe and a portable water supply. And entry facility, eating facility, there should be a separate hall for the midday meal program. And talking about lavatory, separate female and male lavatory should be present, and one latrine for 100 students and one urinal for 60 students. One urinal for 60 students, you can remember like urinal, urinal, 6 letters, so 60 students. And lavatory, latrine for 100 students. So talking about health appraisal, the second domain, the health appraisal should be periodic examination and daily morning inspection. Daily morning inspection in the assembly and periodic examination of health will improve the health condition in the children. Talking about your nutritional services, that is your midday meal program and your applied nutrition program. So the midday meal program will be discussed later. The applied nutrition program is nothing but your seeds, manure, and equipments for the school gardens. Talking about first aid and emergency care, for that the teacher will be trained to provide first aid care and emergency care for the students who have been injured or who have got any acute illness. So the primary first aid treatment is necessary for the school children in order to provide an adequate care over emergency conditions. Talking about your dental examination is carried for 1 year. And eye health care, as I already said, the visual acuity cutoff referral is 6/9 that you can write here. And reduction of refractive error and the trachoma is done by the school teacher. So also in the school health program, vitamin A administration is also done. So this is about your school health program. Thank you for watching.